Good morning and Happy New
Good
Year to
morning.
you, Matt Hancock.
Well, Happy New Year is an optimistic way of putting it. It is very tough at the moment.
Indeed, it is. And we're going to look at how the restrictions are working in a moment. But can I start by asking you how we might get out of these restrictions? You've said you want to vaccinate 40 million people by the middle of February. If that target is met, and we all hope it will be, will lockdown end?
Well, we are on track to offer vaccinations to those who are in the top four risk groups, as you say, by the middle of February. That's the over 70s, those who are in old people's care homes and their carers, and NHS staff and social care staff. So we're on track to deliver that. We're delivering over 200,000 vaccinations a day at the moment. But vaccination is for a purpose, and so everybody's asking the question of how we get out of this, and the answer to whether that is immediate is that it won't be, because after you've vaccinated people who are vulnerable, firstly there's a 2 to 3 week gap before they get immunity, and during that time we will be watching very carefully the number of people who end up in hospital, the number of people who die from the disease. The goal and my hope is that the link that so far has been very strong between the number of cases and then people ending up in hospital with a couple of weeks later, and sadly the deaths numbers going up. That link will be broken by the vaccine, because the number of people who suffer from serious disease are overwhelmingly amongst the elderly, who we're obviously getting to first with the vaccination program. So the answer is not immediately once we've hit that target, but that will, the fact that we will get there, and we should get the top four priority groups having been offered a vaccine by the middle of February, means that we will be able to get out of this sooner than we otherwise would.
Do we have to get the R rate below 1 to ease restrictions?
Well, we've got to get the R rate below 1 much sooner than that, Gloria, because at the moment hospitals are under so much pressure, and there's a risk, as the chief medical officer has set out today. There's a risk that the fact that we've got this medium term optimism, and by medium term I mean in a few months' time, the fact we've got optimism there means that people let up in the short term, and we just can't. We've got to keep the virus under control right now, and so that's we've got to get R below 1 now, because otherwise the pressure on the NHS will only mount.
Okay, we've recorded an interview with Graham Medley, which will be playing out a little later in the programme. As you know, he's a member of SAGE.
Yeah.
He was speaking to us in a personal capacity. He wanted to be clear that he wanted that to be pointed out. But let me play a short clip from him, if I may.
I
Sure.
think it's fairly clear from all the data that's coming through in terms of travel and work and schools that the impact of the current measures is not as dramatic as it was in March. And so I think that we are not going to see a reproduction number fall as low as 0.6. Sincere hope that it gets below 1.
So, Matt Hancock, why, my question is if the virus is 50% to 70% more transmissible, do we have a less strict lockdown than we did in March?
Well, what really matters from here on in is how people behave, and people need to stay at home. I'm at home now, talking to you from my own office. Everybody's got to stay at home. And what matters, of course, the government rules matter, and people should not, push the limits of them. People should stay as far inside them as they can. But it's on all of us. And yes, we keep these things always. We're looking vigilantly at the data, and talking to the scientists, like the professor. But what matters is the behaviour of the public. And I know I've said this countless times over this pandemic, but it matters more now than it has done at any point since March. We've got to get this under control. And when a scientist says does an analysis of is this going to bring the R down to 0.6 or down to below 1, what matters for all of us is that there are people suffering in hospital right now, and hospitals under pressure like never before, and we can all do something about that, which is by following the rules and staying at home.
But the rules are more lax. Nurseries are open, for example, not just for children, but for garden centres too. I mean, why more lax than the March lockdown?
Well, we have taken in some difficult areas, we've had to take a balanced approach. You've got to. So, for instance, I do want key workers' children to be in school where that is appropriate, where nobody else can look after them, because because I need my nurses and doctors and porters and everybody else in hospital. And we need to keep the police running, and so there are absolutely mission critical services that have got to be maintained. And the decision on nurseries was a balanced decision based on the fact that the very youngest children have the least impact on spreading the disease. All children are safe from this disease. The risks are very, very low. But we know that especially the older children do spread it, and that's also true, but to a lesser extent in primary school. Hence, we've taken the decision on primary schools, even less so in nursery. So, these are difficult things to manage. But everybody can do something about it. It's not just a policy debate. It's something every single person listening to this program can act upon and can play their part in.
Okay, so you mentioned schools. So in the March lockdown, 72% of primary schools had fewer than 10% of their pupils attending. This time, only 17% of primaries have below 10% of attendance. School attendance is too high, isn't it?
Well, we've got to make sure, as I say, that key workers' children that key workers can get to work, because actually, if you ensure that through policy that a nurse can't get to work because she can't get anybody to look after her children, then you've taken out more capacity in the NHS than the risk of that key workers' children being in school. So you've got it's a very difficult balance in that instance. But so we go through all of these individual balances. And we make the best judgment that we can based on the best available scientific advice and based on the most up-to-date data. But I come back to the point that, you can debate the intricacies of the rules all the time, and we are constantly vigilant about what's needed. But fundamentally, it isn't just about the government rules. It's about how everybody behaves and how everybody in that marginal decision, should I go out? The answer is no, unless you absolutely have to. Stay at home.
Indeed, but when it comes to interpreting the rules, particularly on school attendance, there seems to be a large element of self-definition on what an essential worker is. One head teacher reported that a dog walker who walks the dogs of NHS workers is an essential worker. Is that an essential worker that should be sending their kids to school?
No, we've set out who a critical worker is. It's on the gov.uk website. Those parents whose work is critical to the coronavirus and response include those who work in health and social care and in other key sectors which are outlined on the website. Okay. So we should that's all set out on the website, and people should follow that.
So how do we get the numbers down? Why are the numbers so much higher of children attending school? We've got a virus that is far more easy to transmit, but the number of children in school is too high, or is it not? Can we cope with this level of children in school?
Well, we do have more experience, and we've collectively as a society learned a lot more about the virus, and we have testing in schools now that for the schools that have opened, and so that's available. But what really matters is that is actually the behaviour of everybody. You can focus on one particular area, but it's the macro behaviour, and it's the decisions of all of us, everybody, that matters more than each one of these individual marginal decisions.
Okay, do you think there are some parents who are sending their children to school unnecessarily?
I don't know. I haven't seen any evidence of that, but but the rules are very clear, and schools are pretty good in the main at making the right judgments.
Okay. Chris Whitty, writing in the Sunday Times today, says that the NHS risks being overwhelmed within a fortnight. Could you tell our listeners what overwhelmed means? Is it not enough staff, not enough oxygen, not enough space, not enough equipment? What does it mean for our NHS to be overwhelmed?
Well, it fundamentally means this, that the NHS gives us all the commitment as all of us as citizens, that when we're ill, we can be looked after and we can get the best possible care. And that's one of the wonderful things about this country, is that for all of us, that promise is there. And with 30,000 people in hospital with coronavirus, delivering on that commitment is getting stretched. And so, in the first instance, it means that the staff are stretched more. And obviously, we've been building physical capacity and we've been hiring people into the NHS over the summer. But nevertheless, there is that pressure on the NHS. We've seen that some non-urgent treatment has been postponed. We saw that in the first lockdown, and we've seen that again. And I want to make sure that everybody gets the treatment that they need. And postponing something that isn't urgent is not something anybody wants to do. But we will get back. We have been working through the backlog very effectively. But the challenge is when things get even more under pressure, and then the NHS isn't there able to treat everybody, because there's so many people in it. And what matters, again, it comes back to the same thing. I know I keep saying this, but it really, really matters, and it matters that people actually do this and don't just kind of play lip service to it, which is staying at home and reducing your social contact is the way to that all of us can help to get this going in the right direction.
Of course, let's look to the future. Until we are all vaccinated, which you hope to have done, everybody, by the autumn, will wearing face masks be with us on public transport and in shops until that point when every adult has been vaccinated?
Well, I do think that there's going to be quite a lot of things that we do that are essentially a very low cost, that just become normal and social norms. And wearing face masks, I think, is one of them. In the Far East, wearing a face mask is far more normal than it ever was here before 2020. And that's because of their experience of MERS and SARS a decade or so ago. And so I do think there'll be social norms that change. And I think that people will be naturally more careful about contagion. Because, the first goal with the vaccination programme, of course, is to vaccinate those who are most clinically vulnerable, to get the deaths and the hospitalisations down. And then to get a vaccine to everybody, every adult, to offer one to every adult. I hope take up from every adult, and so far, take up has been incredibly high, which is good, and what I expected really. But there will be a time after we've vaccinated the most vulnerable when we see the pressure on the NHS reducing. This is in a few months' time. It's absolutely not now, and then we'll have to be the rest of us will have to be cautious whilst we get through the rest of the vaccinating the rest of the population.
Final one from me. Tom is going to come in next, but I remember you doing an interview during that first wave when you were asked about summer holidaying abroad, And I remember watching it, and you said you wouldn't be booking one. I wish I'd have taken more of your advice then, because I did, and I came back 2 days later. Are you planning any summer holidays this year?
I booked my cottage in Cornwall.
No, no abroad, nothing abroad for Matt
Well,
Hancock's.
I love Cornwall anyway. So, why would you go abroad in the summer? Who can beat the Great British Summer?
Will I be able to go abroad in the summer, do you think? Would you recommend I book a summer holiday
Well,
abroad?
I hope that we're in a much better place. I think that we're going to have a brilliant summer. I think that by then we'll have vaccinated a huge proportion, especially of the most vulnerable. And in fact, we should have, all the vulnerable categories. I hope we will have got through, and I think we're going to have a great summer. But these are uncertain times, and I'm going to Cornwall.
Good morning, Mr. Hancock. It's Tom here.
Are you coming to Cornwall?
I'm not coming to Cornwall. I'm going nowhere. I'm not even booking Cornwall. I wouldn't do such a foolhardy thing. Let me get you back to the current situation where we are, because it really is serious, isn't it? Some pretty grim projections around some pretty eminent people this morning. Neil Ferguson thinks emissions may still go up another 20%. Graham Medley is telling us that he thinks it's 3 weeks before we see any decline in cases at all. What is your assessment from the best you've been told? Given that, and I think it is a massive if, though you don't want to condemn anyone this morning for some reason, if the British public do follow the rules, how much worse do you think it will get before it gets better? And when do you think hospital admissions will start going down?
Well, it's impossible to say in the short term. It really is. And there's only one thing that matters, which is people staying at home and not seeing people outside their household. That's... these data come through each day. The new variant is so much more contagious, and we've seen the data, going up and up, and I want to see them coming down. And that's it. Of course you can make projections, and it's the job of SPI-M. Literally, they are the modelling committee. It's their job to do these projections. But for most of us, it doesn't matter. What we look at is the data as it comes through, and the data as it comes through shows that there's been a very sharp increase in infections, and we needed to act, which we did on Monday.
So some may say it does matter, and it really should matter to you as the health secretary, because if you lose control of capacity, if emissions keep on rocketing as they are in incredibly dangerous fashion, which you admirably concede, then you're going to run out of space. You're going to have to build some more Nightingales. So you should have some idea in your head of whether you've got the capacity now or whether you need new capacity.
Sorry, I was answering the question based on the case numbers and the number of people who are catching it. Of course, in terms of hospital capacity, I expect that to continue to be stretched. And you can see the cases, people who've already caught coronavirus but aren't yet in hospital. But we know, based on past experience, more people will end up in hospital before this then gets better. And we know the timeframes over which that occurs. It occurs typically around a week after catching the illness. If somebody then goes downhill, that is the point at which they are hospitalised. So the next few weeks are going to be absolutely critical. But that's why it's so important to get the case numbers down now, urgently. Hence the very stringent action that was taken on Monday, and hence my requirement of people to stay at home. And so it is going to be the next few weeks are going to be very, very tough in the health service. We always knew that winter was going to be the toughest time because there's all the other pressures on the health service that you get in winter as well.
Matt Hancock, Health Secretary, thank you very much for talking to us this morning on G&T.
Thank you.